When I came to Dr. Nuthi's, I had horrible cramps every month. I would have very heavy periods, and this persisted all throughout my life until I got my first period. Probably about a year after I got my period, I started developing the symptoms. When I would get my period, I would have nausea, I would throw up, definitely miss school, like 3 weeks out of the month, every month.
Endometriosis is when the cells that are inside the uterus, called endometrium, for some reason, these cells will survive outside the uterus. One of the most common theory about endometriosis is the retrograde bleeding. What is retrograde bleeding? Every woman, when they have their cycle, they have some type of retrograde bleeding. That means that the menstrual cycle will go through the fallopian tubes and outside the uterus, and it will stay in the pelvis or in the abdomen. And for some reason, the endometrial cells will survive outside the uterus. When these cells survive outside the uterus, they will stay in the pelvis usually, and they will implant in the pelvis, and they will cause pain with each menstrual cycle. The pain that they suffer from is usually different from a normal menstrual cycle. The pain that somebody has when they have endometriosis is a pain that is very severe, that usually makes the patient stay in bed, miss school, miss work. They usually have vomiting and nausea. Sometimes they even might go to the emergency department because of these severe menstrual cramps.
When I would get my period every month, it was horrible. As soon as I got it, from 2 days before I would get it actually, I would start feeling cramps. I couldn't move out of bed. I would just have to medicate myself and basically sleep throughout my whole period to even deal with it. And not until the last day I would feel like back to normal.
Now, not all the time you have the pain only on your menstrual cycle. You can have the pain during your month, but it's more severe during the menstrual cycle.
Probably I've seen around 9 doctors. 4 times a year I'd go to the ER and try to get some kind of pills to make it feel better, or yeah.
Now, the gold standard to diagnose endometriosis is usually laparoscopy. And laparoscopy will detect endometriosis because we cannot see endometriosis on ultrasound. Sometimes we can see endometriosis on a CT scan or MRI, but usually the findings are very subtle. So it's important to do laparoscopy to find endometriosis.
I mean, it was good that I finally found what it was. Like, I was very relieved to find out that there is hope for my symptoms, and there is hope for them to finally go away.
So if you're going to have surgery for endometriosis, you have to find somebody who is expert in treatment of endometriosis, because the treatment is excision of the lesions.
After the surgery, well, it was my first surgery, so I was kind of I didn't want to get out of bed, but after the second and third day, I was walking and moving around and everything was okay.
What to expect when you have the surgery? Usually these surgeries are minimally invasive. These are done with 1 or 2 incisions in the abdomen, very small incisions. We use a small camera introduced into the abdomen or the pelvis, and when we see the lesions, we usually excise the lesions.
If you, I recommend if you suffer from the same symptoms and go through the same things I went through, I recommend you do see Dr. Nuthi's and at least get an insight more of what this is, what endometriosis is, and you maybe could have it. It's possible.
If you're somebody who suffers from chronic pelvic pain or severe menstrual cramps, and you think that you might have endometriosis, you should come and visit me. You can get my information at my website, www.nuthismd.com.